Everybody, welcome back to Dr. Shane's channel. Today we're going to talk about anxiety, and I have my good friend here, Melanie, and we're going to be talking about her experience that she went through with anxiety, along with what are some of the causes and experiences that people go through and how best we can treat it as well. So anxiety has a lot to do with people who go through excessive fear against some form of illness or some form of problem that they think they may be having. So anxiety disorder falls under the Diagnostic and Statistical Manual of Mental Disorders, which is the last known classification of mental disorders. And anxiety disorder has to do with people who experience excessive fear or excessive anxiety or excessive behavioral disturbances. Anxiety disorder has been classified into different types, and these would include like separation anxiety, anxiety or specific phobias, or just like, for example, generalized anxiety disorder.
All right, so I have what I consider to be health anxiety, where I have excessive worry over my health. So this all started a few months ago in July, early August. I started to feel dizzy. I've been told from I was a teen that I have anemia. So I felt like the dizziness was because of that anemia. I went to my doctor, I got my blood work done, everything came back perfect. There was no fault in the blood work, and so I was a bit confused as to what was happening to me because I was still feeling dizzy pretty much every day. Felt like I was going to faint. It didn't actually happen, but that was where it all started. And then after a few weeks, I started to have other symptoms. So I started to feel chest pain. I started to feel this tightness in my chest. I started to have heart palpitations. I started to have intrusive thoughts. I developed a fear of sudden death, and that fueled the anxious thoughts and the intrusive thoughts, and it just became a cycle. So every time I would feel any of the symptoms, I would start to worry about the symptoms, and then I would get anxious all over again. So that was my anxiety cycle, and this has been going on for about 5 or 6 months. I have been to the doctor about 15 times. I have seen about 20 doctors based on all my visits, and they all said to me, "You are fine. There's nothing physically wrong with you based on all the tests that we have done. This might just be anxiety." I have done x-rays, I've done multiple MRIs, I've been to a cardiologist, I've been to a neurologist. Everyone says there's nothing wrong with you. However, I was still having these physical symptoms that could not be explained. And then to me and my anxious mind, that meant the doctors are missing something. There must be something wrong that they have not screened for, and therefore I need to figure it out so that I can guide them to do the correct test so that they can find the problem and then the solution. Because I felt like if I don't figure it out, I'm gonna die. It's gonna be too late. I'm gonna die. And it's when I'm dead that they're gonna figure out finally what was wrong with me. Obviously, that was not the case. But when I was deep in my anxiety cycle, that's all I could think about.
Well, I mean, let's address some of those things. If you died, we obviously couldn't fix it, right? But that's besides the point. So a lot of the symptoms that she has described are similar to the people who have panic disorders or generalized anxiety disorder. And the fear of dying, the palpitations, the shortness of breath, the dizziness, the worrisomeness, those are all, or being very worried, those are all symptoms that can occur. Anxiety disorder is also classified or looked at as something that you would have to rule out, right? And as you rightfully said, you did many tests. Even tests that I didn't want you to do test. And it took some time for us to get her to the point of which that we thought it was anxiety. When she was having her heart palpitations and the dizziness, we had her do multiple ECGs and echocardiogram, seeing a cardiologist as well, just to ensure that that was ruled out. When she started to have her headaches, I ensured that she got CT scans to ensure that those were negative. When she started to have continuous middle and lower back pain and abdominal pain. I'm sure she got her scans to verify as well that there was nothing going on in that department. And so you also have to ensure that if you're going to classify somebody or diagnose somebody with anxiety, you also have to rule out all the other causes or possibilities that can cause their symptoms. Another thing as well is to develop that patient-doctor one confidentiality relationship, which I think has what has also helped to draw our relationship closer in that sense. And to also, not only it shouldn't just be that your patient is there and your doctor must just listen to you, but your patient also needs to find that confidence in you. Melanie will tell you that as much as I made her do everything and repeat everything, including blood tests, which I made her do because some of the times she was having pains to her body, not just joint pains, she was having bodily pains as well. And things that can cause that include like immunological diseases. And so I made her do screening panels for that as well, just to ensure that everything was okay, which it was. And I'm happy that everything came back normal. For that reason. In all of that, Melanie, whenever she didn't believe that she must listen to me, she went and did her test on her own. Tests that I've told her that we have done and waiting on the results. Tests that I've told her that is not needed because we have ruled this out symptomatically already. Tests that I told her is going to cost too much for her to do right now, so hold off. But Melanie did everything. Whether I liked it or not, Melanie did it. And Melanie knew when she was doing the wrong, because she would do the test and then call me and go, "Well, go on, friend. I have something to tell you." Like, what did you do? So all the tests that I did, all the tests that all her other, but she spent money to go to a doctor too, you know. And all those other tests all came back negative. I think we have tested and scanned almost everywhere. So I am extremely happy that everything came back normal for her. There were no abnormalities whatsoever from a physical testing point, blood testing standpoint. But I think we also need to understand that many people do go through anxiety. Many people do experience these symptoms. And it's not something to take lightly or to just brush off to say, "Oh, you're just going through this whole medication and that's it." I think we also need to listen to our patients and to help them with what they're going through as well.
I think one of the reasons that anxiety was a hard diagnosis for me to accept is because when we talk about anxiety and when we think about anxiety as patients, not as doctors, but as patients, we think that you're telling us that it's all in our heads. We think you're telling us that you're making it up, and if you stop thinking about it, it will go away. And it's really not that simple, because the physical symptoms are real. I am feeling what I'm feeling. However, it is a response to a perceived threat that's not there. And once I understood that, then I was able to really look at the facts, and I laid all the test results in front of me and I said, these are the facts. The fact is, there is nothing physically wrong. You are okay. And then I started to think about it from a psychological standpoint.
I think also what helped Melanie with her progress during that time as well was, one, I think she was also going through some stuff personally as well. I think what also helped her was really just seeing the results itself, physically seeing them, to understand that, I've done these tests and they're negative. So there must be something else that could be causing the issues I'm going through. And her healing process, I think, also started when she was able to understand that other things were negative, tests were negative, and that she was okay from that standpoint. And so she could now start that healing process, because the tests were also worrying her. What if it showed this? What if it showed that? Do I really have something wrong with me? Do I not? And so I'm happy that I was there as well to help her with that process.
So based on my research and my understanding of what causes anxiety, it is pretty much a stress response. And the stress response is triggered through our nervous system that gets overloaded or think that there is an actual threat. So anxiety is a natural part of life. If you've ever heard about the fight or flight response, then that's pretty much the another way that anxiety manifests. It's to help protect you from dangerous situations that are real and in your face that you have to deal with right now. So you're either going to fight the threat or you're going to run away. So during an anxious response, your conscious mind perceives that there is no physical threat, but your subconscious mind feels that there is a threat. So that disconnect leads to that anxiety cycle where you're constantly wondering, am I okay? Am I not okay? I'm feeling this, but the doctor said I'm fine. Could the doctor be wrong? Is the doctor lying? And all those thoughts that go around and around in your mind, that's pretty much the anxiety response because of that disconnect in your nervous system.
So yes, I agree that there is a fight or flight response, but there are also, and that's why anxiety is a ruled out diagnosis, there are also other factors. So there's research that says that for people who go through social anxiety, you can have a genetic correlation of a cause, meaning that if your immediate family member had anxiety before, there is a chance that you can go have anxiety as well. There's also factors that are linked to what you have experienced. So like if you've gone through a traumatic experience, what we call post-traumatic disorder now, that traumatic experience, if something around you happens that allows you to bring up back that memory, you can have anxiety from it. Certain medications, they have said, can also cause you to have symptoms of anxiety, which is why you also have to rule out the diagnosis, go through the medications, see if any symptoms that you're having are due to the medications that you are on, or if you are taking any. People who who have certain illnesses can have it. People who are smoking or taking or having cannabis or can also experience symptoms of tobacco as well. Symptoms of anxiety as well. And so that's why you also have to it's a ruled out diagnosis. Another stimulant that can cause you to have anxiety symptoms is people who love coffee or who love caffeine. Caffeine is known to cause those type of palpitation symptoms that people have, etc. For some people, they don't have the symptoms whatsoever on caffeine. For some people they do. So it really depends on how well your body reacts to it.
So in terms of my recovery process after accepting the diagnosis, because I don't think that you can truly recover from anxiety if you don't accept that it is anxiety that's going on. Once you accept that it is anxiety, then you'll be able to move forward with your treatment. So after acceptance, I sought medical treatment in terms of drugs, and I'm also doing therapy. So I've had 2 therapy sessions so far. I feel really comfortable with my therapist, and I definitely want to continue seeing her so we can talk about if there was anything in my past that is manifesting now that was causing me to be stressed or causing me to be anxious, and also how I am going to deal with stress moving forward so this doesn't happen again. And one of the things that I wanted to point out was during the time that all of these symptoms started, I did not physically feel like I was stressed or that I was anxious. And so that was one of the reasons I couldn't accept anxieties, was because I didn't feel like there was anything wrong in my life or there was anything wrong going on with me to cause me to be stressed or anxious. There were some good things that were happening in my life at that point in time, and I felt like if good things are happening, things that you planned for, whether or not they are big things to take on, your body should not respond to that as stress. And obviously the therapist told me that even if it is something that you planned for, your body, your subconscious can still recognize that as you're having a stressful moment or you're going through something stressful, even though consciously I didn't think that was what was happening. So I have gotten medication for anxiety, which did help me, and I'm doing therapy. So hopefully over time, this will be something of my past that is a fond memory that I can talk about in the past tense.
I don't know what else to say now. I think Melanie has spoken a lot. I agree with her. The first thing for anyone who goes through anxiety is one, to understand that there is help there if you need it. There is somebody who is willing to help, who is willing to walk you through the process, who is willing to be there at your side. Help can be found. But the first step of the anxiety, as she has rightfully said, is that you also, one, have to accept it, and then two, you also have to then be ready to treat it. And so treatment has different tiers, and treatment is dependent on how well you are ready for acceptance and how well you are ready to proceed to get yourself better. And so yes, there is behavioral therapy, there is counseling sessions that are offered that can be done as a patient can get, just to walk them through the process, walk them through them symptoms, to understand why they may be experiencing what they're going through, how best we can help them to become better, what exercises they may or may not need to do mentally to make themselves better, and to just be there for them and guide them. Also, from doing the counseling as well, if that alone doesn't help, then there is medications that can help. There are different medications that can be used. Shortening for one of them that we call SSRIs from in a medical terminology. Some people who go through anxiety also go on antidepressants because of how bad their symptoms may be, and sometimes people who go through anxiety also do get depressed, unfortunately. Sometimes people who go through anxiety so bad that they do have ideation of suicide as well. And so that counseling and behavioral factor plays a very key role in your treatment. For Melanie, when she was going through it, I was at her side throughout. Whenever she wanted to do her tests, whenever she wanted just to talk, I was there. And as much as medically I'll be there, I also still thought that she needed to also see a counselor just to have that experience and that guidance, which I'm happy to say has helped her. So there is help out there. There is help for whatever symptoms in that category you may be going through. So to recap, guys, anxiety is a real thing. Different forms of anxiety do exist. People do go through anxiety disorders. It's not to throw the person aside or to make fun of them, but it's to help them. It's for them to understand the symptoms that they're going through, to rule out any other causes that these symptoms may be causing. And then based on those tests, if the patient is diagnosed with anxiety disorder or what type of anxiety disorder based on their circumstances, then it's good to start and initiate the treatment for them. You wouldn't want their anxiety to get any worse or for them to lead into a suicidal form if their anxiety is too severe. So it's good to get them help, it's good to get them treatment, and it's good to get them better. So thank you guys for watching my channel again. I appreciate you. Hit the like button. You'll get more videos like these and others. And I thank Melanie so much for coming and joining us as well. You'll see her more often. Have a great day, guys.